Good evening, everyone, and a very warm welcome to Medprime's exclusive webinar series, Zoom In with Medprime. I'm Greeshma Unnikrishnan. I'm the CEO and co founder of Medprime, and I'm thrilled to have you all join us today at Medprime. Our mission is to empower diagnostics through innovation, and this session is a perfect reflection of that commitment. Today, we are diving deep into a critical topic, which is the impact of technology in contemporary pathology practice. During the next hour, you can expect an insightful journey through the current digital landscape of pathology. We will move beyond the basics, exploring how technologies like whole slide imaging, advanced AI driven diagnostics, and seamless remote connectivity are not just trends anymore, but they're essential tools actively reshaping the diagnostic workflow. So, whether you are a student preparing for the future or a seasoned pathologist looking to optimize your practice, our goal today is to bridge the gap between technical innovation and clinical reality. Before we begin, just a quick note, we have a packed hour ahead. So, for all the attendees, please feel free to drop your questions in the chat box throughout the presentation. We have a dedicated time slot at the end to address as many questions as we can. Now, today, for our inaugural episode, we are incredibly honored to have with us today Dr. Vamseedhar Annam. Dr. Annam is a distinguished professor of pathology at Sapthagiri NPS University, and he serves as the editor in chief of the Karnataka Medical Journal. His extensive clinical and academic background makes him the perfect guide to help us navigate how digital tools and technologies are reshaping the modern pathology workflow. Dr. Anam, thank you so much for joining us, and we're eager to hear what you have to say. So, over to you.
Yeah. Thank you, Greeshma. Thank you, Medprime, for giving me this opportunity for considering me for the inaugural webinar. And today I am trying to give an overview about the latest update, how the traditional has slowly taken over by the present technical pathology, means the digital pathology, how it has slowly overtaken. So my title of the topic is the impact of technology in contemporary pathology practice. So here I would like to tell that traditional pathology, we usually see the glass slides and we'll be making some diagnosis. But technology has completely transformed this contemporary pathology practice, shifting it from a subjective glass slide based discipline to a precise data driven science. Innovations like whole slide imaging, artificial intelligence, and molecular diagnostics, they have caused a lot of changes like increasing the diagnostic accuracy, TAT. Mainly, it has reduced the TAT, and also it has made remote consultations seamless. On the left side, you're seeing the traditional microscopy. On the right side, you're seeing the slide imaging. Routine practice, we use the glass slides. We see under the microscope and through the eyepiece, and we make a diagnosis and release the report. Whereas in digital imaging, what has happened is we are scanning the entire slide, and the images which are digitalized, means they are stored, they can be again reviewed and analyzed. So on the right side, you can see the peripheral blood smear, how we see and how it is almost like static. We'll be moving certain areas and we'll be trying to pick up the platelets or any neoplastics, that is leukemics, blasts, or RBC morphology. All these things we'll be seeing under the microscope, but after some time we'll become tired. Whereas in on the left side, you're seeing the low resolution and also the high resolution, how they appear, and these images again you can relook once you are fresh. So the peripheral blood smear, you can make a better diagnosis and it can always give a better view. So now we have to shift to the digital pathology, right from the traditional pathology. So the time for change has already started. So this is the whole slide imaging wherein we take the glass slides which are digitalized into high resolution images, eliminating the need for physical storage and enabling instant global sharing. So we take the glass slide, we do the whole slide scanner, we'll do the image, we take the whole slide image, and later the image will be viewed and analysis will be done. So till this, most of us we have very good knowledge about this one. That is how from a slide using a whole slide scanner, taking the image and how we are going to view it. Because even in our KCFM slide seminar and all, we usually get the digital images wherein we will be seeing the images and give our opinions. So, what is this digital pathology doing? It is improvising upon the laboratory workflows. It is increasing the diagnostic consultation, improving the patient care. How it is, I will tell you. Collaborative research. It enables technology by database, data sets, and you can find out some new technologies. And also, major important is telepathology. So the productivity of digital pathology, it has improved the workflow. It fosters collaboration. Central storage enables easy access in streamlined workflow. It curbs trend towards outsourcing, allows for automation, flex work schedules, and also remote access. It reduces the turnaround time, mainly faster access to archived digital slides, reduces the time retrieving the data, watching and matching and organizing, speeds up access to samples, and improves TAT versus manual reviews, especially in complicated cases. That is some complex cases. More innovation, it can be done using the big data, allows pathologists to become more specialized. It allows practices to extend to broader geographies, delivers better tools for teaching and also for training. So how it is going to do this telepathology support? Because mainly by this whole slide images, whatever it is scanned, it can be sent through mail or different modes of communication by WhatsApp or any of those things globally. And it can aid in this tumor board discussions and subspecialty reviews. All these areas it can be used. It enhances collaboration. How it is going to enhance the collaboration? Mainly by multidisciplinary team meetings, which are streamlined as digital slides can be projected and reviewed simultaneously across different hospital networks. So these are some of the advanced digital and smartphone integrated microscopes. Earlier, during my PG times, we were using the microscope which was connected to a camera at the top, and that was connected to the system, and we were seeing under the microscope, and the image we were seeing under the computer, that is a screen. Whereas now you can use the smartphone directly or tab you can use, wherein it allows the pathologist to view, capture, and stream live slides directly on mobile devices. Even there are some mobile microscopes wherein you can carry on to whichever place you are going for a short while for a tour or something like that. You can take your mobile, you can take this mobile microscope, you can view there using the tab, and you can make your diagnosis. Also, it is helpful in AI-assisted analysis. Recently, Silica AI reticulocyte count, wherein you need to take the images by regular images manually. Those images you have to upload to the software. It will count the total number of reticulocyte count within few minutes, whereas manually it takes more time and it is tedious. It also has now recent microscopes. You are having dual viewing system wherein one person who is sitting next to you. Earlier we were struggling because I was focusing into the microscope and I was focusing one area and I was telling my colleague that this area there is granuloma. So again once they come they will see it was if the area was a little moved away, then the granuloma would have missed. But now what has happened in this dual viewing, the advantage is you are viewing under the micro eyepiece. At the same time, you are focusing under the tab or mobile, whatever it is, and you can tell this is the area of the lesion and what type of lesion it is, and you can discuss directly. This allows doctors to seamlessly switch between traditional eyepiece viewing, and also digital displays without losing the focus. Then automated image analysis. Here, after you do this automated image analysis algorithms, it can be done. And this can reduce the time because once you prepare that algorithms, that is counting the mitotic figures, measuring tumor size, and grading diseases, all these things, it is little laborious when we are reporting. But because of using these algorithms of using the automated image analysis, it becomes more easier. After we take fixation, after fixation, automated embedding, then tissue block is prepared. The tissue block will be taken for section cutting, then flotation, automatic staining, the glass slide which contains the image, that is which contains the tissue, which stained tissue is seen. This one now we are take to that whole slide scanning scanner, and the entire slide will be scanned, wherein we will be seeing the entire image. This image now it has to undergo image analysis. How this image analysis we are going to see in the subsequent slides. Once that is done, LIS, Laboratory Information System, it is going to finally release the reports. So after scanning, what has happened is we'll prepare that model wherein all these entire slide, whatever has been captured, there are some white spaces, pixels in between. Some pixels contain the tissue area, which is that colored area. So once these image blocks, that is pixels, are being captured, the white pixel will be removed and only these colored pixels will be taken. In this again, there are different colors, pink color and blue color, all these different color areas. So this color normalization will be done, and next we are going for double unit, wherein we will be trying to remove these artifacts, whatever artifacts are there, that will be removed. And finally, a pixel which contains the tissue of tumor cells, or it could be lymphocytes, or it could be stromal cells, any of these things. So that will be classified whether it is a tumor area or whether it is a lymphocyte area, or that is inflammatory area, or it is stromal area. So based on that, the color coding will be given, and accordingly, how much tumor is there, you can visualize and you can identify. So how this artifact, this area, how it is done? It is classified based on the severity. Here you can see more than 50% of the pixel, it is showing the artifact that is high severity. If you take a mid severity, you can see the entire screen, that is a pixel, wherein less than 50% you are seeing the artifact. That fold is seen here. Whereas in low severity, that fold is not seen, but still you can appreciate that some artifact is there and the cells are visualized perfectly. So this is how high, mid and low severity artifacts are been divided, classified, and they will be removed. So now what you are going to do is you are having this tissue biopsy. Sorry. Tissue biopsy or blood smear slide, whichever slide you are taking, first you have to undergo that quality control check by using color texture, detect image artifacts, use image smoothing and normalizing to remove the noise when it is processed. Next, image description will be given. You are going to extract the color and texture, shape and surface features from segmented images and extract high level features. After the image description, next you are going for predictive modeling, wherein you are selecting the region of interest. ROI is nothing but the region of interest, that is tumor area or lesional area. You are going to pick that one. You are doing that quantitative analysis, means you are counting the total number of tumor cells. You are means in the sense the AI is going to count the total number of tumor cells which are there. So following this, it will acquire the knowledge by using feature selection and reduction. Finally, it will classify whether it is normal or abnormal. So after this, it will go for the clinical diagnosis. At the same time, exploratory analysis, you will be identifying feature patterns by using supervised clusters and spatial patterns, whether it is papillary pattern or a glandular pattern. So all these different patterns will be appreciated. It will identify those things. Finally, after this clinical diagnosis, you'll be going towards the prediction of grade and staging and survival rate of the patient. So finally, we will we can try to explore novel prognostic factors. So this is the pattern recognition. So deep learning models can identify subtle micrometastasis in lymph node. You can see here, this is the patient chest CT was done. Same patient, the biopsy was taken. This is the tumor for tumor detection. This is weekly supervised learning. This is the first option. Next, you have to restrict the tumor area. You have to mark that area. Then you have to do the size magnification. Pixels you have to take out, and you have to see the size magnification. So here you have made so many number of pixels. Now you are going to train and test. You have to, if you can validate this one. Cross validation can be done. At the same time, external validation can also be done. Now the tissue sampling, whatever we are taking, we are preparing the slides, digitalizing those things, region of area of interest, we are going to take and make a diagnosis of adenocarcinoma. So till here, most of us, we are having very clear picture about this one. Now the next half, that is the future aspect of pathology, relating whether it is cytology, hematology, or histopathology, relies on these areas wherein the AI analysis is which is being done, it will evaluate and the same time report is done along with the genetic test. How these are being done. So that concept I'll be telling next. So before that, whatever tumor here we are detected, tumor segmentation plus nuclear count will be done. AI score will be given. You can modify that AI score. Finally, pathologist consent is required. So here you can see this is the case of breast cancer pathology. Breast cancer, you can see the tumor along with some areas of hemorrhage. This is the in what has been given. The patches which have been processed by this deep learning. You can see the high complexity, resource intensive, poor generalizability, and it is a difficult integration with LIS. You cannot do that one. And here you can see the lesion location in this tumor. This is the non-tumor area. So molecular prediction, what exactly it is. So here you can go for this IHC precision or molecular biomarkers or genetic biomarkers. Examples have been mentioned. So interpretable and transparent. It is more means the task-oriented, optimized AI models. Whatever you are doing here, here is the person, here is the AI model. So it is interpreting and it is more transparent and it is reliable and it is resource optimized and greener. So what is the role of this AI in pathology? AI excels in key tasks that complement human expertise, mainly slide trash, wherein it is going to segregate things, segregate the tumor area, segregate the inflammatory area. So it is going to that do that triad system and tumor detection. It tackles vast amounts of image data quickly and efficiently. So once it is trained, it is able to detect that one. Quantification for mitosis and lymphocytes and biomarkers, all this quantification that is being done by AI and identifying the regions of interest wherein the exact tumor cells are there or whether there is some other granulomas or any of those things, whatever you want to find, you have to train the system. So here you can see this is one of the case of sorry. So traditional histopathologic evaluation of cancer, it is performed at multiple scales of magnification and resolution in order to categorically examine various kinds of complex phenotypic features. Here you can see all those things, what a pathologist will do by seeing these areas. We will be telling about the tumor cellularity, architectural distortion, tumor growth patterns, tumor associated stromal characteristics, inflammatory response, presence or absence of necrosis, invasive borders, cell shape, relative cell size, cytoplasmic appearance and features, distribution of the size of the malignant nuclei, nuclear contour, nuclear color, okay, nucleoli, presence of that mitotic activity, almost all these things we will be doing. But what we are not able to do here is pathologists do not and cannot routinely count or characterize every single cell of hundreds of thousands of cells in every tissue section. Certainly, we cannot count each and everything, because why this becomes important, because it is valuable in terms of number of tumor cells in a given cancer type, and what proportion of these tumor cells are at leading invasive border of the tumor, and that could be coupled to the distribution of size of tumor cells in different areas of the tumor. The second thing is evaluating mitosis. So the estimated mitotic rate based on the focus of the tumor with the highest number of mitosis, instead of counting the total number of mitosis that are present in the tumor. It is difficult. What we usually do is 10 HPF, that is a 10 high power field will typically go for that 40x, and we will be seeing how many mitosis are there. We'll give approximate. So in next topic, what I will be telling, that is about the pathomics. What exactly happens here is it is going to quantify all these things. It will quantify the assessment of the structures and features at multiple magnifications to complement traditional histopathologic evaluation by the pathologist. So here the AI, what it does is it has the capacity to automatically detect regions of cancer in whole slide images to complement low magnification assessment of tumor growth pattern, tissue architectural distortion, and increased cellularity. So I think you are seeing some blue, purple, no, not purple, blue, red, yellow, some areas. So here what has happened is the blue color areas, whatever are there, that is a different one. It is usually a non-tumor area. The red color, usually it is a inflammatory area. And the yellow color, that is the tumor area of interest. That is how it is going to categorize. What are these pathomics? So now coming to the topic which I just told in the previous two slides, wherein how a traditional pathologist, how we are going to report the slides, and the second slide was about how uh, artificial intelligence and machine learning is observing the slides. So this is on color basis, where it is going to tell blue, yellow, or red color, whereas we are going to identify the cell size, how it actually happens. So Pathomics, it is an emerging field that utilizes artificial intelligence and machine learning to extract massive quantitative data sets from digitalized pathology images. So, by transforming traditional microscopic observations into objective, measurable features, it enhances cancer diagnostics, prognostics, and personalized therapy. So, Pathomics takes this step further by scanning physical tissue slides into high resolution whole slide images. So here you can see, I had shown you in the before slide how it occurs. Here you can see this entire area, the some area of the tumor. So we have marked this area of the tumor. So this area of the tumor, the other areas are all benign. It is showing bluish in color. So now once you come here, these yellow areas are nothing but the tumor areas. The red color, whatever we are seeing, that is the inflammatory cells. The gray color, what you are seeing, it is nothing but the non-tumor area. So how much inflammatory cells are present along with the tumor cells is going to explain you the tumor microenvironment. And this is certainly going to help for the clinicians how to treat the patient when the patient is having this tumor microenvironment. So here you can see the pre-treatment, pathological features, and model building. So how it is happening is, first we are going to see the region of interest by HND slide, and we are normalizing the color, and image processing is done. This much I had already told you. Now manual extraction is done. At the same time, machine extraction is also done by using its coding language. I told you that color language. Finally, both are clubbed. That is the pathomic features, wherein machine learning and artificial intelligence both are clubbed along with our digital pathology. So how it is distributed, that spatial distribution, the nuclear signatures, machine extraction, it does the extraction, then organization structure, how it is, microenvironment, tumor microenvironment, and the scoring system. So finally, what it does is the pathomic features how it is seen. Machine learning is only about color, dot colors. And finally, this is the pathomic model, how it is created. And this pathomic model itself will tell what disease it is and what stage and what type of treatment modality it has to be given. So importance of pathomics in modern medicine for enhanced diagnosis. Pathomics enables rapid and accurate diagnosis by leveraging advanced image and machine learning techniques. It helps in personalized treatment by supporting tailored treatment plans, by providing insights into tumor biology and patient specific responses. It also helps in research innovation, wherein Pathomics will drive innovation in biomedical research, facilitating large scale data analysis and collaborative studies. So, machine learning applications in pathomics, wherein automatic tissue classification for faster diagnostic process. It identifies abnormal patterns in histopathological images effectively. It leverages patient data to forecast disease progression. It generates structured reports from image analysis seamlessly. It ensures consistency and quality in diagnostic imaging workflows. It helps in tailoring treatment plans based on histological data insights. It streamlines pathology workflows to enhance efficiency and accuracy. So integrating pathomics with genomics, it has got a big data, leveraging large data sets to improve disease diagnosis and treatment. It helps in data integration, that is genomic data with pathology images for comprehensive analytical tools by utilizing algorithms which we would have prepared to analyze integrated data resource sources for better accuracy. And it helps in clinically by implementing findings in clinical settings to enhance patient outcomes. So pathomics and clinical decision support systems, how it occurs by using the data, the collect digital pathology images and reports. Next, analysis. We'll use AI algorithms to analyze pathology data, insights, that is, extract actionable insights from the analysis. Collaboration. Engage healthcare teams to discuss findings. Implementation. Integrate insights into clinical workflows and systems. Feedback. Gather feedback from clinical teams on effectiveness. Refinement. You have to refine the algorithms based on the clinical feedback. So this is how the entire support system, how it has to go in Pathomics. So machine learning algorithms scan the digital tissue to quantify the data by looking into the cellular morphology, exact measurement of the cell size, shape, nuclear characteristics, and age gradients. It is done. Tissue architecture, that is spatial relationships. Tissue architecture is nothing but how it is oriented, geometric orientation or density of various cell types, then texture and color, variation in tissue staining that map molecular or immune statuses invisible to human eye. Clinical applications of pathomics are nothing but by capturing tumor heterogeneity and microenvironment, pathomics unlocks several powerful applications, that is predicting survival, treatment selection, and patient stratification. So predicting survival, it is by multimodal models like pathomics, merge pathomic data with genomic data to accurately predict patient survival rates and disease progression. Then treatment selection, it helps determine how a patient might respond to the therapies such as neoadjuvant treatments. And patient stratification allows for more fine-grained objective disease grading compared to traditional visual grading systems. So comparison to other fields, like just like pathomics, there's something called genomics and radiomics. Pathomics is one branch of larger omics. So pathomics, radiomics, and genomics put together, it has become omics revolution in modern medicine as of now, which is going to take over down the line after 5 to 10 years. While radiomics extracts quantitative features from macroscopic imaging like CT or MRI scans, pathomics operates at the microscopic level. When combined with molecular data, it provides a holistic view of a patient's disease. So here you can see on one side, left side, you are seeing radiomics, that is region of interest, it is selected here. And pathomics, region of interest, that same thing, it is selected here. So we'll feature the extraction, then genomic sequence will be done. Finally, the omics fusion is done. And based on this omics fusion, you'll be having the final diagnosis for clinical treatment. So treatment you are going to assess again, then you are at the same time you can understand how the mechanism of this disease process has occurred, something like tumor environment or biological pathways, etc., which will help for finding out concepts, new concepts, or research works. So current challenges in Pathomics implementation, one is the SWOT analysis is strength, opportunity, weakness, and threats. The strengths are integration of AI facilities, improve workflow and efficiency in pathology labs. Opportunities, a growing trend towards telemedicine enhances demand for digital pathology solutions. Partnerships with techie companies can accelerate innovation and market penetration. Weaknesses are nothing but it is limited understanding of digital pathology among healthcare professionals that is hampering the adoption, because most of the areas we have seen that digital pathology means it is something related with technical, and we usually try to move away from that. That is becoming a major weakness. If we can utilize the digital pathology along with the routine, I think it will make, along with this advanced technology, if we can implement, it certainly makes a lot of sense. The threats are rapid advancements in technology may outpace current pathomics development. Regulatory challenges could limit the speed of implementation and scalability. So, what are the challenges and future outlook? The technology integration requirements. Successful adoption involves investment in scanners, AI software, and supporting IT infrastructure. So, then the second one is the data security and privacy. Protecting sensitive patient genomic and medical data from cyber threats is a major priority. Then the next one is the pathologist of the future. Here, the pathologists are evolving into computational diagnosticians, requiring continuous training to validate and interpret AI-generated results alongside genomic data. So, thank you very much for your patient listening. And a few more things I just wanted to add on, wherein uh, related to this ethics, that is, it is actually well, so it has already been started at different places means countries like UK, USA. They have already started. Some Halo company in USA, Apereo in again that is in USA, and Denmark. They have all started with this one. Only we need to gear up. Thank you.
All right, thank you so much, Dr. Vamshidhar. It was really interesting to hear about, the clinical perspective of digital pathology and pathomics, and I'm sure the audience has also found it fascinating. I request everyone to please drop in your questions in the chat, and we can address them to Dr. Vamshidhar. Uh, in the meantime, I will just read out a few questions that we have already received. So the first one was for institutions or say smaller labs that are looking to modernize. What is the first step that you would recommend to start integrating digital pathology without completely overwhelming the existing team?
Actually, there are three components which I had told in today's presentation, which will be very effective if it is implemented. One is related with digital pathology. Second one is artificial intelligence. The third one is pathomics. So coming to this digital pathology, that is the basic step and first step, wherein you need to have a very good microscope. Along with that, you need to have a very good slide scanner, which will certainly be helpful for at least we can go for first half, wherein we can see the slides digitally, and we can train the PGs. We can tell them that this is the future, and they can again review the slides after few days. Again, they can we can show the same slide, same digital image, and we can ask them. So the first step, what I would suggest is first you can start with the digital pathology with the microscopes, slide scanner, and digital image teaching process. So once that is done, the next part will be artificial intelligence and machine learning, wherein we need to tie up with the technical person, that is engineering person. Then we need to proceed further with how to develop the software, and how to go for the other aspects in technology. Yeah.
So that brings me to the next question. Is that what is the biggest, most common challenge that you have seen that pathologists face when they're transitioning from a traditional microscopy system to a digital workflow? And how would you, what would be your suggestion for them to overcome it?
The first problem always we face is cost. So if the cost is more, we'll feel better. We will not go for that equipment or whatever it is. But to be frank, digital pathology is actually reasonable. What I usually tell, because you are using investing only for one time, and afterwards you can just use the same thing. For example, if I remember during my PG time in Hubli and Bijapur, wherein we were having the regular binocular microscope, we were seeing the slides, and now when I want to see that slide, that image, that slide stain is almost gone. Means it is reduced. It has become more dim. The staining which I was seeing during my PG time, it was so good, and now I am not able to show that slide to my PGs also. I had some beautiful collections of slides. Some slides it has faded. Even some of my colleagues, to name Dr. Suguna Madam, she also has very good collection of slides. Those slides we want to show to the PGs and teach them. It has become so difficult. If we are having digital images which we could take those things and teach them, it will be helpful for next generation. That is one thing. And main problem what is acceptance. One is the cost factor, the second one is acceptance. We need to accept that yes, we have to proceed further. We have to take the technology, start using that and move forward. That's how we have to go. But majority of the areas we see, why I have to use the technology. I'm happy with whatever is there. So that that thought actually should go off from the mind. We need to move on, because earlier we were having whatever notes, 1,000 rupee notes was there. So all those things are gone. It has moved on. Just like how life is moving forward, we have to just get attached with those things. It's just like go with the flow. We should not think back. I don't want to go to this. I am orthodox. I'll see only in this microscope. We have to remove those that stigma. We have to go for the advancements, whatever is there. We have to accept it, proceed, learn and proceed. We will enjoy that one.
Right.
I hope I am answering to the
Yes,
questions.
definitely. What I'm hearing you say is that, like any other technology, there will always be a little bit of resistance or, difficulty in shifting from X to Y, but the benefits that you can get out of it are much more. Like, you have to, if you adopt it, there are so many more advantages, like, creating databases of interesting cases, rare cases that are good for, education and sharing the knowledge. So I definitely understand what you're saying. So I think we've gotten two more questions. The first one is from Dr. Sushant Thakur. Adoption of digital slide scanners is very low considering the cost benefit. analysis, mainly in monetary terms. What value proposition should be considered for future Pathomics approach?
Now, can you repeat the question? I did not understand the
I
question.
think what he's trying to say is that the adoption of slide scanners is quite low because it's more expensive. So, but what is the value proposition that should be looked at or considered if you are considering planning to use it for future in Pathomics?
No, long-term slide scanner certainly will be a very good investment because when we are having slides, for example, you are running a pathology lab, regularly you are seeing the slides and you are reporting and you are giving to the patient or you are discarding the slides if hematology slides are there. But certain cases, wherein anemia cases, wherein you are seeing some, the person has come for microcytic hypochromic anemia, it is of severe, the HB is less than 4. Okay, I am just giving one example. If it is less than 4 or 3 grams, patient is having thalassemia, sickle cell anemia, whatever it is. So during that time, you can take that image, you can keep it and mention that date. The patient will come after 1 month or 2 months again. You cannot store that slide. So all like that, you cannot go on storing the slides. You can just go on adding the images to the cloud. You can store those images and you can go back. As this artificial intelligence, immediately it will identify that patient name. Once you type that patient name, all that slides will be displayed in front of you. You can identify, okay, first the patient came with this problem. Now the patient has come for this. So like that, it will be certainly beneficial for the clinician and also for the patient, wherein you can explain them in a better manner. And rather than storing all those things in files, etc., which was the old customary which we were following, later in future stages it becomes very difficult. Because storing a slide for after 1 or 2 years only, it becomes faded, and again you cannot retrieve the slides. That is what I was trying to tell. Slide scanner means you are scanning the entire slide; it is there. So that image itself will safeguard. Even if you go for that legal issues also, you are always having that advantage of telling that no, this patient had so and so problem. So that area also it can sort out. Means long run it will be certainly beneficial, and you can also tie up with some companies who are going to do research work on certain diseases. That is. How the disease process has occurred, right from beginning till so and so for 6 months follow up or 1 year follow up. And based on that, you can start giving one hypothesis that so because of these things, the disease process is going like this. You can formulate a pathogenesis and treatment modality might modify. For example, if I want to tell you, when HIV started, during that time, initially there were 1 or 2 drugs, then IRT, slow heart, like that, the tablets went on getting modified. But one phase, it so happened that immune problem the patient is having. So they started giving additional multivitamin supplements along with the immune boosting drugs. That's how the treatment got modified. All this happened because of doing some concepts or hypotheses which the we have observed and we have explained to the clinicians.
True. So there we have another question from Nandini. Are there any training programs? And I would like to add a little bit to this also, ki, if for a student or for someone who is in doing their pathology, MD pathology now and looking to be familiarized with these technologies, what would they focus on? How do they go about it? Like the question, are there any training programs to familiarize themselves with the latest technologies?
Training programs regarding
For digital pathology, whole slide scanning, Pathomics. um,
Pathomics, actually, it is the upcoming one. So you will not be getting that much number of training so fast. I think down the line you might come across. But digital pathology, most of the conferences, CMEs they're conducting, and Medprime also has conducted few CMEs, I think, or guest lectures on digital pathology. You can join any of those things. If you want to know more about this artificial intelligence and machine learning, better option would be you can tie up with a techie who has done computer science, AI with this thing, machine learning, and you can start clubbing your pathology with them, and yourself will become a pathomic.
True. We have time for one last question. Dr. Sunil has mentioned that this is definitely useful for histopath and pathology, and he suggests that it can be used for acid-fast staining as well. And he has asked if you are planning to use this in the microbiology field as well.
Certainly, but I think uh, the amount of involvement towards microbiology, it has to start up, gear up. It is not gone to that level. In pathology, it has gone to certain level. That is also in baby level, not even this thing. Microbiology, it is still in the fetus level. So you have to take out that. But certainly, it can be used for identifying microorganisms, even culture plates wherein the organisms grow. You can categorize that one based on the amount of growth of the organisms. That can also be done, but you need to still that amount of work has not been done. It is under process.
Okay. So I think that was our last question. And with that, we have reached the end of our session. Um, so this has been really fascinating, Dr. Annam, and thank you so much for your time today. Your insights into the evolution of digital pathology, from the mechanics of whole slide imaging to the transformative potential of AI, they have provided our attendees with both the why and the how for the future of our practice. To all our attendees, thank you so much for your active participation and for the excellent questions that kept this conversation so engaging. Before you log off, a quick reminder that all attendees will receive their participation certificates via email shortly. Please follow Medprime Technologies on our social media channels. We will be having more installments of Zoom In with Medprime, and we have more exciting topics lined up that you won't want to miss. On behalf of the entire team at Medprime Technologies, thank you so much for joining us. We hope you leave today feeling more equipped to navigate the technological landscape of contemporary pathology. Have a wonderful evening. Bye.
Thank you very much.